guys. Make sure it's open. Guys, and even, again, pin these open if you can. Did you try it?
They just fly out.
They fly out? Yeah.
Yeah.
Okay.
Let me get the last one.
Guys, here's that diaphragm that we want to be cutting away. Here's the diaphragm right here, because we can see here's thoracic cavity, here's the diaphragm, the dome of the diaphragm. So we want to cut this away. Somebody can hold that there. Thanks, Mikhail. Trust me? All right. So we're going to cut the diaphragm away. Okay. And then the same thing on this side. Thanks, Mikhail. Okay. So what we have, guys, is the mediastinum. Okay, that was on the exam the other day. That's the medial compartment, medial to the lungs. And again, second half of the course, we're going to talk more about pulmonary and digestive structures. But generally, there's 7 lung lobes: superior, medial, inferior, and then there's a lung lobe that's called the mediastinal lobe, and that's between the diaphragm and the heart. That's
Cats have more lobes than you do.
They have more lobes. Yep, they're all separate. They're like 7 separate lungs, really. Okay, so instead of having, they're called lobes, but they're really like 7 mini lungs, basically. And they all have their own primary bronchi coming off into it. Diaphragm, guys, remember, this is skeletal muscle that's autonomically controlled. By tissue nature, it's skeletal muscle. Into the abdominal cavity, think of your quadrants: upper right, upper left, lower right, lower left. The liver is going to take up most of the upper right quadrant. The spleen in the stomach is going to take up most of the upper